Good morning, ladies and gentlemen. I am a thoracic surgeon, and like you, in orange, have been spending much of our professional lives treating patients with lung cancer, majority being smokers in yellow, and many of them in late stages. Besides being a thoracic surgeon, my public health passion, started a decade ago, has been largely on prevention. Going upstream to the left is the focus of this tobacco-free generation talk, and how we can now stop a pandemic that has festered more than 5 decades, killing 8 million a year. Let's start by examining how successful or unsuccessful have global. On the left, from TFGi, an international tobacco control non-government organization, shows a plot of number of countries in this y-axis adopting the 2003 World Health Organization framework for tobacco control. And this is plotted across the years in x-axis. These colored lines at the bottom depict the 6 measures by the acronym MPOWER. And as of 2012, at the rightmost end of this category is the number of countries that have implemented that specific category. Are we really winning? Asked the executive director in 2014. On the right here, Hoffman from York University plotted the annual change in cigarette consumption per capita before and after this WHO framework labeled as FCTC. Unfortunately, the year-on-year per capita change within this purple 95 confidence interval and the red line has not reduced even with FCTC. Even more sobering, experts projecting to 2050 that even with more of the current measures by 25% or even 50%, will not see prevalence in y-axis ever reaching down to 0. This WHO National Cancer Institute report still expects the number of smokers to climb globally. Why do we continue to lose? For starters, there have been global blind spots missed by experts, global bodies, and governments. So this is where I start explaining the tobacco-free generation approach. In 2010, I published this paper in Tobacco Control Journal titled Phasing Out Tobacco. Although originally referred to the year 2000 and after, this birth year can be any other year. For example, birth year 2005, 2010, as seen here. It is basically focused on children who have not been addicted. Specifically, it means children born in and after a predefined birth year are educated better where they no longer want to smoke. With massive community support, it can then be legislated. Its biggest advantage is that this approach does not target these yellow dot smokers who are older smokers born before that predefined birth year, unlike current measures of raising taxes and restricting smokers to yellow boxes, causing more disharmony. A year after our publication, Professor Ruth Malone, Chief Editor, Tobacco Control Journal, coined the term tobacco endgames, as they were initiatives designed to change or eliminate permanently the structural, political, and social circumstance that is sustaining the pandemic. Tobacco-free generation is one such endgame, and its focus is on these unaddicted smokers, their children. On the right, you will see other identified endgames, all of which apply curbs, policies, or restrictions on these supply and demand chain elements. So how exactly does this tobacco-free generation notion change these dynamics? For starters, it replaces the globally accepted flawed minimum age law. This goal of the minimum age law is that there will be no smokers to the left or younger than the minimum age legal law depicted by this vertical black line. But in reality, for decades, depicted in this red here, kids hear and see a mixed message. They are told it is bad, and yet it is okay after an adult age. Away from checking mechanisms, the rebellious teenager is curious, enticed, and eager to demonstrate to his peers the fearlessness and the ascension to adulthood, whatever the legal age. The industry cleverly exploits this law.
Big cigarette company, they always think that government sooner or later will come up with new regulation, okay? So they always anticipate from the beginning by doing investment to the young one.
Be aware of the brand.
Yeah.
And be addicted to nicotine.
Yeah.
Who was your primary target?
Young one. Young one.
What age?
Let's say unofficial, 14 plus. Official, 18 plus.
Okay, but unofficial, 14 plus. Yeah.
Yeah.
Got it.
Unofficial.
Unofficial.
You know what I mean, right?
So this legal structure of minimum legal age even allows the industry to exert its business legitimacy and take legal actions against jurisdiction. With a birth year-based approach, we have none of these complex collateral damages, but now have a better public health standards for our future generations, akin to the vaccination against COVID-19. With the tobacco-free generation law, we have coherent structural public health position. Most importantly, tobacco industry can no longer claim legitimacy, no structure for them to hang on. For that identified birth cohort and after, no one starts smoking whatever age and improve social dynamics. Let's explore now the second major global blind spot. A global accepted paradigm is to restrict and penalize smoker. This lady tells the man to stop smoking. Smokers are getting frustrated, being pushed from pillar to post. Such expletives and violence are not unique to any society, as evidenced by these other reports. Ultimately, it is our future generation, like that little kid, that will suffer, while the culprits, not just this smoker, but also the industry, slips away. The tobacco-free generation approach reunites this divide. By having a defined date-based onset, this has no impact on addicted earlier birth cohorts. Up to 60 to 70% smokers support our notion in the population-based study that we did. The third major blind spot is a combination of our weak education content and education ecosystem. First, the content. This paper analyzed 474 grade 1 to 9 school textbooks from 9 developing countries for compliance with the World Health Organization recommended content for tobacco prevention as tabulated here. On this pie chart, only a meager 6 books, 1%, covered resistance and life skill, which is the most important of all. This paper clearly illustrated the misdirected education content. So right after the 2010 publication, we started designing and building our tobacco prevention education ecosystem. It needs to go beyond saying smoking is bad or causes various diseases. Instead, it is their peers who needs to be groomed, stand in front, and advocate to the thousands, to the hundreds of students, to generations and cohorts after. It needs to be an ecosystem that gets permanent internalization through mass education in the schools. For every passing cohort, and for every child in that cohort to resist every random, vulnerable encounter as they pass through that natural, experimental phase of their lives. It needs to get that precise matching to the teenager's developmental phase, activating positive peer pressure and developing sustainable youth leadership within the education system. You will learn a lot more of our contextualized mass education content and approach by watching Lynn's presentation right after this. She presents the thematic analysis and respondents' outcomes, and data from our unpublished data and from others show an overwhelming acceptance of TFG across different study populations. This is a bird's eye view of the education ecosystem outcome, which can be roughly defined into 3 phases. In blue, following our publication, was the content development phase, where we jointly developed with medical students and youth, achieving much greater appeal and impact during mass education than merely showing smoking-related deaths and diseases. In black were the regional and international conference endorsements, unsolicited international parties getting the win of TFG, and issuing verbal and written support. The red here were the exponential 3rd phase, as it rapidly spreads across different communities, driven by able and inspired youth and their governing leaders. Small sampling of the burgeoning international support for TFG. British Medical Association wrote in support of TFG. The former Director General of World Health Organization said tobacco-free generation should be supported very strongly, very strongly. These medical associations and organizations from Tasmania and Australia have written in support for TFG. TFG delivers a more harmonious and complete global language without any more mixed messaging, antagonism, and industry claiming legitimacy. The smokers support TFG. The 21st century birth cohort knows what to do. And all of us then can have this increasing gratification that we have built a tobacco-free generation. Tobacco-free generation novelty comes from the fact that it is using a new implementation date rather than age to tobacco control for the first time. A date-based policy called grandfathering is a well-accepted public policy making process. Many examples abound. One is the emission standards of vehicles governing the pollutants released into atmosphere. All new vehicles registered from a certain year must comply with the new Euro emission standards. 2 international community examples and 2 take-home messages. This is in the Philippines, where I initiated the program with a local mayor in this province of Bataan from 2015. Within a year, there was overwhelming public support where it is enough for a local legislative body to execute and implement the world's first tobacco-free generation ordinance. This social movement has now spread across the other 10 municipalities across the province. This is a town called Brookline in Massachusetts. They first worked on TFG in 2016. As of November last year, there was a strong majority voting in favor of the tobacco-free generation law. It has now been passed up to the next review at the state level. So TFG is a single, simple psychological construct that unites smokers and non-smokers to vanquish 6 decades of blind spots and social divide. This phased-in, non-antagonistic social movement will result in no new smokers in your future generation. We now have the education ecosystem that has been well tested and accepted across different communities and countries. Having shown that it has worked in garnering support from all sectors of society, including politicians, and that it can also be a legal instrument. I like to close by emphasizing that it is each person's responsibility, each society's education sovereignty in how you teach your future generation better. So communicate with us to help your community to learn more and start this social movement. I thank you for your time.